Okay, let's see. My husband is curious about testosterone treatments. What do you think? Oh my God. The biggest scourge in the country right now is testosterone treatments. Testosterone will inhibit your pituitary gland, FSH and LH, and so it'll turn off your testicles and you will stop making sperm. Now, what happens is the testosterone that you're taking replaces testosterone you would be making. So your testicle is no longer making testosterone and is no longer making sperm, but you feel strong. You feel all the impact of testosterone because you've raised your testosterone level. So I am very, very concerned that so many men are prescribed testosterone because they want to be stronger. Their muscles are getting weaker. Their doctor gives them testosterone. However, no one tells them it turns off their sperm production. And then they come into our office wondering why they're not having babies. They've been trying to have babies for 5 years, and what's wrong? I don't understand. We find out they're taking testosterone. So you stop the testosterone, and the sperm production should come back in somewhere between 3 and 8 months later. But I'd be very cautious about taking testosterone. Make sure you're done having babies before you do that.